Treating trauma in individuals. In this module, we'll look at some of the tools and techniques for treating trauma. Treating trauma can be very complex, and this is only intended as an introduction, not a comprehensive guide. This diagram shows an example of a trauma recovery model. We won't cover all of the detail here. The important thing to note is that different levels of intervention will be required, depending on the individual's symptoms and behaviours and their readiness for treatment. Here the layers of intervention change as we move from behaviour that is unstable and chaotic, through building trust and developing relationships, working through trauma, showing insight and self-awareness, increased self-belief and esteem, until finally the person being treated is exhibiting confidence, independence, and achieving their goals. Trauma-focused work often involves different stages of treatment based on an individual's needs. For example, treatment for those with complex PTSD could involve these 3 stages of treatment. Stabilisation. This is about supporting the individual to develop an understanding of their difficulties and to develop skills and strategies to help them manage their symptoms. Processing the trauma. This is often the key stage in the treatment and is about processing the traumatic memories to allow the brain to store them away correctly. This can be done through a number of techniques, such as CBT or EMDR. Reclaiming life. Trauma can take a lot from us and prevent us from engaging in the life that we wanted to lead. This final stage of work is about supporting people to re-engage in a meaningful life. It's important to note the treatment process is designed at an individual level, and this 3-stage process might not be for everyone. Next, let's look at a few simple techniques people can use when they re-experience traumatic memories. People often experience unwanted flashbacks of their traumatic experiences. To help bring attention back to the present moment, we can use grounding. This means focusing all 5 of our senses on a task we are doing, such as a hobby or domestic chore. Sometimes re-experiencing trauma is triggered by something which was present at the time of the trauma. This could be a sight, a sound, a smell, a place, or a person. In these cases, we can try to discriminate between the then and the now by asking what's similar to the time of the trauma and what's different. When feeling anxious or threatened, our breathing rate increases. Focusing on a smooth, regular rhythm to your breathing can help calm your body's responses to feeling threatened. Finally, safe place imagery is about creating a place in your imagination where you feel peaceful and safe. This could be somewhere you have been to, want to go to, or even an imagined place. Try to engage all of your senses in seeing the place in your mind's eye. Again, this can help soothe our body's response to feeling threatened. We need to be aware that hearing about traumatic experiences can have an impact on our own health and well-being. It may trigger memories of our own trauma histories, and it may affect how we interact with our clients. We recognise this as secondary trauma. If this is not acknowledged, we could find ourselves failing to enforce boundaries, missing appointments, or even abandoning clients altogether. Like our clients, we can benefit from simple strategies to build our resilience, self-care, compassion, and a balanced life. Let's look at these in turn. Self-care is all about engaging in activities and practices to maintain our emotional and physical well-being. This can help mitigate the stress of caring for others, which can lead to burnout. We need to make time for self-reflection, not always easy when faced with heavy workloads and other demands on our time and energy. It's important to take regular breaks away from the office, keep a to-do list to prioritise tasks, leave on time at the end of your shift, and avoid checking emails at home. Above all, tell someone when you're not okay and put a wellness action plan in place with your supervisor if you feel stressed or anxious. Developing a compassionate mindset is all about seeing the world and ourselves with kindness and care. This is not simply a case of being nice and ignoring the negatives. Being compassionate means allowing ourselves to be human and make mistakes, being motivated to care for and help others, being open and honest with ourselves, learning from our experiences, and showing warmth and kindness. Finally, let's look at the importance of a balanced life. We can think of our life as a ceiling being held up by pillars. Imagine one of these pillars crumbles and falls. If we only have one or two pillars, the whole ceiling will collapse. But if we have many pillars, the ceiling will likely stand firm. Think about the pillars in your life. A well-balanced life will involve participation in several areas. Contribution. How can I use my personal ability and talents in some way to help others? Hobbies or leisure. What allows me to use my creativity or gives me a sense of enjoyment or achievement? Exercise. What can I do to get my body moving? Family. What family relationships will help my life feel full and enriched? Alone time. Being by yourself and thinking, how can I look after myself? Personal growth. What would help me grow and develop as a human being? Work. What kind of work is valuable to me? Primary relationships with a spouse, relative, or special friend. What quality of relationship do I want to be part of? And friendship. What friendships are important for me to cultivate? In this module, we've looked at the basics of trauma treatment, some techniques for managing when we re-experience traumatic memories, and we've considered how we can build resilience in ourselves and others to help mitigate the impact of trauma. In the next module, we'll look back at what we've learned throughout this course.